Hi, my name is Abigail Ray. I'm a clinical pharmacist for the Department of Supportive Oncology at Atrium Health Levine Cancer. Today, I will be discussing the use of off-label medications and some basic principles that you and your loved ones can use to ensure safe medication use. During this presentation, I will answer the following questions. What are off-label medications? What should you consider when deciding about any new treatment, including off-label medications? How to talk to your healthcare providers about off-label medications, and where to go for more information. What does it mean for a medication to be used off-label? To understand what off-label medication use is, I first want to take some time to explain what it means for a medication to be approved or have what we call a labeled reason for use by the Food and Drug Administration. Using a medication on label means that the Food and Drug Administration, or the FDA, as I'll be calling it going forward, has approved a medication for use in a specific medical condition, and it is being prescribed or used for that same reason. You may also hear this FDA approved reason for use called a medication's labeled use. Before a drug can be approved by the FDA, a drug company must prove through clinical studies in humans that the medication is both effective and safe for a specific medical condition. The company must also apply for FDA approval, which can be very expensive. If a company wants FDA approval for use of their drug in multiple different medical conditions, they are required to get a separate FDA approval for each different condition. Off-label medication use is when an FDA-approved medication is prescribed for a reason that has not been FDA approved. Using medications off-label is common, and your provider may prescribe a medication off-label because we do have clinical studies in humans that the medication is both effective and safe for a specific medical condition, but the drug company has not yet, or maybe does not plan to apply for FDA approval for that condition. This is common as the FDA approval application is expensive and time consuming. We talked about why healthcare providers may use medications off label, but why is there an increasing interest in off label medication use among patients and the general public? On social media and other public forums, we're seeing an increase in popularity for holistic or integrative care that may stem from mistrust in the medical system or other reasons. There seems to be a growing interest in what I would call repurposing existing medications for cancer treatment. This is mostly due to social media and website posts where people make claims about a specific medication treating or curing them. However, there's no way of actually knowing whether the claims made are true. This also may stem from mistrust in the drug or pharmaceutical companies. A third reason people may use off label medications is out of concern for side effects with standard therapy. Because of this increasing interest in off label medications, I wanted to discuss some details and questions that you should ask before you consider starting an off label medication. These are really the same details that should go into any discussion between you and your healthcare team before starting a new medication, whether it's going to be used on or off label. So these principles really do apply to any medication that you're considering starting, but I am going to be focusing on off-label medications for the purposes of this presentation. The first factor is safety. All medications carry side effects. There is no such thing as a medication without side effects. They just vary in how severe those side effects are. Many of the popular medications being used off label for cancer treatment at the moment are antiparasitic medications. So they've only been studied for short-term use because they're only intended to be used for a few weeks when treating a parasitic infection. So we don't have any information about how safe these are to use long term. Additionally, not all medications are safe in all medical conditions. There may be lab work or other tests that we need to do to ensure that the medication will not be harmful for you. And depending on the medication, there may need to be lab work before you start the medicine, after you start, or potentially both. When you are thinking about whether an off label medication is safe to take, I would consider the following questions. What are the side effects of this medication? And has the provider who's offering me this medication, or do I know about the potential side effects? Is this safe to take with all of my other medical conditions? Is the person offering me this medication aware of my full medical history in order to ensure that this treatment is safe for me? Are there any lab work or tests that need to be done before you start this medication? And finally, is it safe to use this medication long term? Do we have safety information when this is used for months or years? These are all very important because we're seeing a rise in popularity in purchasing veterinary grade medicines without a prescription, as well as online prescribing where you're never actually seeing a doctor. This is really concerning because when you're not seeing someone before starting something, none of these questions are able to be answered or addressed. We not only want to make sure that a medication is safe, we also want to ensure that the medication will actually work for its intended use. I'm calling this its effectiveness. Many of these off label medications that are being endorsed on social media have only been tested in lab studies. You may also hear this called in vitro studies or studies in animals. However, just because a treatment seems promising when tested in the lab or in animals, this does not mean they will work the same in humans. In fact, often experimental treatments and new drugs in the development process fail when they get to the human level testing. That's because humans are work differently than animals or the cells used in a lab. Um, or if an off label medication does have studies in humans, these are often much smaller and therefore have a lower level of trustworthiness than the larger trials that we have for our FDA approved standard therapies. When considering if an off label medication will work for you, make sure you can answer the following questions. Has this medication been studied in humans for the condition that I am hoping to treat or manage? How well does this medication work compared to the standard therapy? Do we know that information? Has this been compared to standard therapy at all? How will I know if this treatment is working for me? Am I going to have follow-up scans or blood work? How long do I need to take this medication before I can expect to see an improvement? And if I don't see an improvement, will a change be made to my treatment? Medication interactions are also important to consider because any new medication, whether it's a prescription, over the counter, or an herbal supplement, may not mix well with the medications you already take. Medication, before you start an off label medication, make sure that you can answer these following questions. Are there interactions with the new medication and my current medications and supplements? Are there any side effects when combining these medications that I should be aware of? And is the provider who is prescribing this new medication aware of all of my current medications and supplements so that we are able to make sure this medication is safe for me? Making sure that you are obtaining information from a trusted source is also very important. While social media and other online posts and forums are very helpful in finding community and support, they are also places where false information can easily be spread. When someone claims that a particular medication cured or treated their cancer or other condition, there's no way to check that this information is true. We call this um, anecdotal evidence because it has no studies or data to back the claims that this person is making. Maybe they were taking standard treatment alongside the off label medication, and maybe they did have a good outcome. But can we really decide whether that good outcome was because of the off label medication, or was it because they were also on standard therapy? We live in an online or digital age where likes and views of a person's videos or other online content make them money. And very strong opinions or opinions that go against the way that most people think often get more attention and therefore more money. They post um, divisive or opinionated content as what we call clickbait to get views. And unfortunately, people use this to their advantage to make more money. Because of this, be cautious when listening or reading online information. Nothing in medicine is one size fits all, and you should be very skeptical of anyone who is making broad claims about a medication or treatment being a cure all for everyone. Questions to consider about trustworthiness of sources include: is this person making claims of a specific treatment working for them or someone they know? And are they expecting me to take their word as the truth? Is this person or company making money from me watching their content? Is it possible that they may be exaggerating in order to get more views or more people interacting with their content in order to make more money? Are they making broad claims about a cure-all treatment? When your care team here at Levine Cancer recommends a treatment, they have made that recommendation based on your specific individual factors. These might include your age, your other medical conditions, medications you take, and your lab work and organ function. They combined all of those individual factors with the evidence we have from our standard therapy clinical trials to help you choose the best treatment for you. The same cannot be said for this one size all online content that's being put out. The next factor to think about is follow up care you are getting or will get. No medication is completely without risk, and all medications should be checked on regularly to ensure that they are working for you and are still safe for you to take. Make sure that you are thinking about follow up plans before you start taking something on your own or before you get medications from someone like an online prescriber. The following questions are: is someone monitoring me for side effects? Do I have regular follow up with this provider to check in? Or do I have a way to reach a provider or a healthcare professional if I'm concerned that I'm experiencing a side effect? If you purchased a veterinary grade medication without a prescription, or you're getting this medication from an online prescriber, the only thing that you potentially had to do was fill out an online form. So the answer to these questions is probably no. And there may not be any follow up lab work or visits to make sure that things are going okay for you with these routes, which can be very, very dangerous. The final thing to consider is cost. Many of the popular off label medications today are very cheap for holistic wellness or online clinics to obtain, but they often charge much higher prices for their patients. And they do this because they make high profits. These clinics and providers often don't accept insurance, so all of that money has to be paid out of your pocket. Depending on how much this treatment costs, this can become very expensive. So, questions to consider when it comes to cost would be: does insurance cover this treatment? What is the cost per treatment? And how many treatments will I need? What will the total cost over time be? If one treatment or 1 month is only $20 or $100, that may not seem terrible, but how much money am I going to spend over time? If you're undergoing months or potentially years of treatment, this can be a lot of money. If you have any questions about using off label medications or other supplements, I encourage you to share your interest with your healthcare team. We can help answer your questions, provide guidance, and even refer you to integrative oncology if you are interested in learning more about complementary therapies. Be sure to share all of the medications or supplements that you take so that we are able to make sure that there are no side effects or medications that may not mix well. This helps make sure that you are getting the most out of your treatment and that you're not accidentally taking something that may decrease how well one of your other medicines works. We want you to be able to make the best decisions for yourself, and we help we can help provide the information that you need in order to make those decisions. If you have any questions, we encourage you to ask your care team about how to talk to a pharmacist here at Levine Cancer. You can also ask for a referral to see the integrative oncology provider. Finally, the American Cancer Society provides further information about off label medication use that you can find at the URL address on this slide. I hope this video was helpful and that you feel more confident when it comes to making decisions with your healthcare team about your medications. Thank you so much for watching.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.